I saw Amy, who is a 32-year-old woman, for a rhinoplasty consultation as well as liposuction under the chin. She felt that she always wanted to have her nose made smaller and be less pointy because she noticed a bump on the bridge of the nose and that her nose projected too far from her face. As well as on the front view, she felt the tip deviated to the right side and she had asymmetry with a little bit of a crooked nose. And so the goals of this procedure were to reduce the hump, straighten the nose, and bring the nose back closer to her face.
I've wanted it done for a long time, and I just feel like, especially I feel like it's crooked, and when I smile, it kind of accentuates it, and I can breathe a lot better, like if I just kind of pull it over to the side. I do think it will really help my self-esteem. My mom is very supportive because she was there in high school when kids would kind of tease me with having such a pointy nose and stuff. And so I've always wanted it done, and she's always known that, so she's really happy for me.
Rhinoplasty is a very exacting operation and really requires a very thorough physical exam as well as the use of computer imaging to aid in demonstrating anticipated results. This is your before photograph, and as you can see, the tip and the climell are over to the right, and so what we're going to try to do is bring that back over to the center, and that will require some cartilage grafting as well. And then on the side view, you've got a little bit of a hump on the profile, and what we want to try to do is try to refine that so that it's not as prominent.
I'm very excited. I've wanted it done for a long time, and I can't wait to see the results.
Careful preoperative markings are done on the day of surgery, and the patient is then brought to the operating room where the surgery is performed with a twilight type of anesthetic. It curves like this without an acute angle. So the reason for it, I'm going to expose this here, is because her septum has a sharp point at the bottom here going into the nasal spine. So if you can see, the septum comes down like this and then curves. But that point right there, I'm going to shave down so that that does not push this out, and then this should be able to go back up and in. It's blocked by this way. Bony contouring was part of Amy's operation in order to narrow the nasal bones, and this is just demonstrating the final check after the procedure is completed, where I make sure that I'm happy with the way it turned out.
Another thing about the recovery process is Dr. Agarwal, he didn't have to make an incision right underneath my nose here. He did everything from the inside. So I feel like the bruising, the swelling, everything was really minimal.
You can see on her before and afters on the front view how the tip is more refined and also straighter. On this right social profile, the tip's been lifted slightly, the nose is closer to the face, and it's just more of a pleasing bridge of the nose. On the right lateral view, you can see how I brought it closer to her face, as well as taken away that very obtuse angle between her lip and her nose. And so overall, it's more in balance with the rest of her profile. And then as a side note, you can see how the liposuction helped under the chin.
I'm thrilled with the results. It's better than I even imagined it could be. I love my new profile. The bump is gone. I love my chin. I'm really, really happy. Everyone says how natural it looks, and in fact my mom says that I look a lot younger. She loves the results.